Good morning. My name is Neha. I am from 3rd BDS RV Dental College, JP Nagar. Health Talk 1. Mode of communication for my talk will be in English. Topic for today is tobacco cessation on youth and counseling them. Before I start my brief, I wanted to share a quote. Cancer is no joke. Quit that smoke. Contents for my topic will be introduction, statistics of tobacco, potential benefits of tobacco cessation on oral health, Health Organization policy on tobacco, 5 A's which help people to quit tobacco, motivation to quit tobacco, conclusion, summary and references. Before we start watching a movie or an advertisement or through posters, you would have come across a sentence called tobacco smoking is injurious to health. So what does this sentence mean? What is tobacco? Tobacco is a plant whose leaves contain high-level directive chemical called nicotine. After harvesting tobacco leaves, they are cured, processed in various ways. The resulting product of this is in the form of smoke, as in cigarettes, cigars or pipes, and applied onto the gums as dipping and chewing tobacco or inhaled as snuff. Since tobacco contains nicotine, a kind of a drug that can lead to addiction, hence difficult to quit. Also contains harmful substances like carbon monoxide, chemicals like benzene, arsenic and formaldehyde. You might have come across a question in mind as to where and how did it all start from. So starting in the early 6000 BC by the Native Americans, the leaves were burnt and taken up as smoke. Tobacco use and exposure to tobacco smoke harms oral and overall health, including oral cancers and other mucosal lesions, oral clefts, periodontal disease, dental caries, premature tooth loss, which also includes early childhood dental caries, gingival pigmentation in children. Bronchial asthma, vasoconstriction and problems in inhalation can also be seen. Coming to the statistics on tobacco use, it is one of the major causes of death and diseases in India, which accounts for nearly 1.35 million deaths every year. India is also the second most largest consumer and producer of tobacco, which has a variety of products and is available at shops and marketplaces and resourced in industries at a very low cost. According to the Global Adult Tobacco Survey of India, smoking like bidi, cigarette, hookah, smoke less such as kaini, gutka and steel liquid, which is also taken up in India. As the recent report suggests that the city with highest smokers is in Kolkata and highest number of bidi smokers are in Uttarakhand. The number of tobacco cigarette smokers in urban areas are more far when compared to that of rural areas. But it's the reverse that we can see in the case of deaths. That is, people who smoke bidi are more in danger and hence seen majorly in rural areas than urban. So in 1954, it was taken up that 45% of this increase has been highest till date, and in 2002, a slight decrease in the statistics of tobacco. In 2015, the rate was 32.20% as there was a decline of 5.9% seen since 2010. But in 2018, the rate was 28.10% and 4.1% decline was seen since 2015. In 2018, there was 28.10%, same as that of the previous year. In 2020, the rate has come up to 27.20% with just a decrease of 0.9%. So there is a slight increase as well as decrease in the usage of tobacco by the people. In 2022, it has gone up to 49%, which is the highest till date that compared to 1954 year. Now that we have discussed on the stats of tobacco, let's move on to the potential benefits of tobacco cessation on oral health. So what does the term cessation means? Cessation is nothing but something to end or bring something to be annealed. So patients supporting their life or vision to quit tobacco could be an integral component of routine and oral and dental health practice. After cessation of tobacco use, patient will see an immediate and long-term benefits, both oral and overall health. One might ask, what are the immediate and long-term health benefits of quitting of smoking? So after quitting, within 20 minutes, the heart rate can be the same as the blood pressure rate. After 12 hours, the carbon monoxide level in the blood drops to normal. But in 2 to 12 weeks, the circulation improves and lung function increases. Within 1 to 9 months, coughing and shortness of breath decreases. Within a year, the risk of coronary heart disease would decrease about half a normal smoker. Within 5 years, stroke risk will be reduced to that of a non-smoker of 5 to 15 years of quitting. Within 10 to 15 years, the risk of lung cancer falls drastically and also helps to maintain overall hygiene and health. People of all ages who have already developed smoking related health problems also benefit after quitting. At the age of 30, they can expect a 10-year of life expectancy, and at the age of 40, about 9 years of life expectancy, and at the age of 50, about 60 years of life expectancy. And at the age of 60, they can expect their life expectancy for more than 3 years. This is generally because of the improved overall health they can see in themselves after they have started to quit or are quitting. The most important factor is that people who already have had heart attack can also have a reduced chance of another heart attack by 50%. Not only the active smokers, but also there is a term called as second-hand smoking or passive smoking. What does this term passive smoking mean? Involuntary inhaling of smoke from others, people's cigarettes, cigars or pipes, in which children are most susceptible to it. Hence, quitting will reduce the chance of impotence, having difficulty in getting pregnant, having premature births of babies with low birth weight and miscarriages also. Than the active smokers, the passive smokers are the one who get highly affected by inhaling the smoke of the active smokers. The World Health Organization brought up a policy on tobacco. In 2002, the World Health Organization members states that is the WHO FCTC, which is nothing but the Framework Convention Control of Tobacco. It came into focus in 2015 where 182 parties covered 90% of world's population into effect under the Article 8. So what does Article 8 state? Principle 1. Protection against exposure to tobacco smoke to create a 100% smoke-free environment. Principle 2. All people should be protected from exposure to tobacco smoke. All indoor spaces should be smoke-free. Principle 3. Planning for adequate resources are essential for implementation and enforcement of smoke-free world. Now let's talk on the 5 A's that help people to quit tobacco. First A is ask. Identify all tobacco users at all times. Second is advise all tobacco users to quit. Third is assess. Determine the readiness to make an attempt to quit. Fourth is assist a patient with a quit plan with a specialist support. Fifth is arrange. Schedule a follow-up of contact orders for us to support their health. As a study keeping in mind 5 ways to help people help quit, I have alongside with me Mr. Suresh. So Mr. Suresh, I would like to ask you a few questions regarding tobacco. Do you use tobacco?
Yes, I do.
As tobacco is very harmful to overall health, I would like to advise you to quit.
Sure.
I would like to assess if you are ready to quit.
Yes, I will support.
I will assist and arrange you to a schedule for a follow-up, and I will make a quit plan and a specialist support.
Sure.
Thank you so much for helping me in my study on tobacco cessation. After speaking to Mr. Suresh, I explained him about the potential benefit of tobacco cessation and hope it improves his overall health. Sometimes you can come across cases where people are not ready to quit. So we have the 5 R's of motivation for them. First R is relevance. How is quitting personally relevant to the people? Second is risk. Potential negative consequence of tobacco use that is relevant to him or her. Third is rewards. Benefits of stopping tobacco. Benefits such as improved health, improved sense of taste and smell, and by saving money, etc. Fourth is roadblocks. The most important, the upcoming barrier for quitting. Barriers such as stopping a person who is ready to quit. Fifth is repetition. Repeat assessment of readiness to quit. I would like to summarize my topic where we have discussed about the introduction, statistics of tobacco, potential benefits of tobacco cessation, the World Health Policy, the 5 A's and the 5 R's. I'd like to request everyone who is under the influence of tobacco to quit today. Please avoid passive smoking because it is more injurious and harmful to the body than what an active smoker does. My references for the given topic is from the textbook of Preventive and Commentative Dentistry by John J., the Google Scholar, and the WHO monogram on tobacco cessation for the youth. Last but not the least, I would like to thank Dr. Deepthi ma'am from the Public Health Dentistry Department for the guidance and giving me the opportunity to speak on this topic. I would like to also thank everyone for their patient listening. So before I leave, I just wanted to leave a message to everyone to stay healthy. So what we need to burn on a daily basis are calories and not tobacco. Thank you.